No bold detailing, honor and integrity. Call or text 585-993-1636.
There's a steroid called Dexamethasone, and people may be familiar with it as prednisone, which is 6 times weaker. So dexamethasone is a pretty potent steroid. It's used to decrease inflammation in the lungs. And there was a 6,000 patient study done by Oxford University in the UK that showed that it was highly effective in treating patients who were in the hospital on ventilators and getting oxygen. It got them out of the hospital quicker, which frees up hospital beds and equipment, and it shows that we can protect those most at risk as we reopen the economy.
And so what's the percentage of people who are kind of recovering using this steroid?
Well, only about 15% of people that get COVID-19 end up in the hospital. So of those who are on ventilators, it helped 30%, and those with oxygen, 20%. Those are significant numbers to help them survive, get out of the hospital quicker. Crucial, because the death rates are overwhelmingly seen in hospitals for those people using ventilators and oxygen. So it really impacts those most at risk.
So this is not treating COVID itself, it's treating some of the symptoms and inflammation seems to be kind of the key to so many different illnesses and the reason why so many people have issues. And this is treating this so that people can breathe better?
Well, it absolutely treats the symptoms of COVID-19, and one of the most serious ones, which is lung failure. It clears the lungs up, it gets the virus out of the lungs, and allows people to breathe on their own and heal quicker and get out of the hospital. All steroids have side effects. Anybody that's taken prednisone knows that they do. But in this case, the benefit far outweighs the risk. And a 6,000 patient study is quite significant. It's very robust. It's highly powered. So as doctors in the U.S. begin to look at the data from this study, I suspect that it'll become the standard of care for patients on ventilators and oxygen almost immediately in the U.S. The Oxford study was a very well-designed, very large study. And people will look at the data before they make their decisions. So people will be able to, question the design and the findings quite robustly. I'm convinced that they're going to find it's going to be highly effective. This has been around for a very long time. This particular steroid is used to reduce lung inflammation for people with all sorts of different diseases. It's already approved. It's generic. It's low cost, and it's available. So it's a fabulous triple play relative to treating the most at-risk population for COVID-19.